Good morning, friends. Myself, Dr. Praveen Sarda, and in today's episode of Ask the Expert, we are going to explore a very common topic that gets asked to me repeatedly, which is about shoulder dislocations. So, what is the shoulder dislocation? The shoulder is designed in a way that it should provide you with a good range of movement, but at the same time, this comes at the cost of stability. So, if you look at this picture, the anatomy of the shoulder is in the form of golf ball and tee, which means that the ball of the shoulder joint and the socket covering it is only about a third of the diameter of the ball, which means that the shoulder has to rely heavily on soft tissue factors to provide stability. So what happens when a shoulder dislocates? So there are numerous soft tissues like the capsule, what's called a labrum, which is like a ring around the shoulder joint, and ligaments. If any of these soft tissues gets injured due to some injury or a fall, etc., that can result in loss of stability and the ball pops out of the socket. That's called a shoulder dislocation. There is another condition wherein the shoulder can dislocate without any apparent damage to the soft tissues, and that is quite common in people with what's called systemic hyperlaxity. In simple words, it means that your tissues are a little bit lax, you are naturally more elastic than normal, and that predisposes your joints to dislocation. Shoulder is the commonest joint to dislocate in these conditions. The other common joint to have problems is knee joint. Next we come to the question, how do we treat shoulder dislocation? So if it's a traumatic dislocation, which means you had a dislocation after an injury, and your age is less than 20, then you are at more than 80% risk of redislocation with what we call a conservative treatment, that is without an operation. So if you have damage of tissues due to an injury and you are quite young, then you better see a shoulder specialist, get an MRI scan, and if there is damage to the tissues, you may be better off having it repaired. Equally, if you are in the older age group, then the risk of redislocation is not so high, but you should definitely get assessed by a specialist to see the need for any intervention. On the other hand, if you have features of systemic laxity, then you may not be a good candidate for surgery. This is a critical question because I've come across many cases where people have had surgery and then obviously because the problem lies with the tissue rather than the injury that you see on the MRI, it just stretches out over a period of time and the shoulder starts dislocating again. So in the next episode, I will explore more about how do we repair a shoulder after dislocation, and these days you can expect fantastic results with the aid of keyhole surgery, and I will show you in the next episode how the surgery for shoulder dislocation works. Thank you very much.